Well, we're in chapter 24, module 155, and this is lecture number 2. And this is where we're actually going to be doing our Google Slides. Remember that there is going to be a complete set of PowerPoint slides in your folder, in your Edmodo folder, so you can refer to those at any time. But without further ado, let's get straight into it. So, radiology. So let's talk about how the radiology section is formatted in our CPT. It is divided into sections: diagnostic radiology, diagnostic ultrasound, radiologic guidance, breast mammography, bone joint studies, radiation oncology, and nuclear medicine. I will be posting a video of how that I have my CPT labeled in this section. I'm not going to show you right now, but I will do a separate video that will kind of give you an indication on how that I actually tab that. Because you know, guys, I'm the tab queen. I love everything labeled in tab, but that will be coming a little later. Radiology is the branch of medicine that uses radiant energy to diagnose and treat patients. Now, I know that we did some medical terminology in the previous video for our lesson, but I'm going to point out a few other medical terms. So, ologist is a specialist. Graphy is making of a film. Gram is a record of a picture. Now, we already had those. Graphy and gram are a little different, but still the same. I kept those definitions the same as that was in your step-by-step manual. So let's look at arthrography. What is that? It's the process of recording a joint. Bronchography, process of recording the bronchus. Tomography is a process of recording a slice. Because remember, tomo is a slice. Arthrogram is a record or a picture of a joint, because arthro is a joint. So what is arthritis? Well, itis means inflammation. So arthritis is inflammation in your joints. Itis, inflammation, exclamation point. That may come up even though it's not written down anywhere. Hint, hint, in an exam. So itis means inflammation. Let's talk about component coding. There are 3 component terms: professional, technical, and global. Now, this is where we're going to talk a little bit about modifiers. And I just need you to pay close attention to what I'm saying. Go out and dig on your own. These modifiers can be a bit tricky. Professional is a 26, technical is a TC. But let's get a little bit more into that. So, professional component 26. The professional component describes the services of the physician, including supervision of the taking of the X-ray film and interpretation of the X-ray films with report. This is the physician. Modifier 26, if only the professional component is being coded. So, is it the physician interpreting it and supervising it and then giving a report? So let's learn a little bit more about modifier 26.
guys, welcome back to Medical Coding with Blue. Today's episode is all about modifier 26. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. I have been a medical coder for over 10 years. I really love sharing the things that I know with all of you. So I hope you'll take a second, hit that subscribe button, hit that like button, and at the end of this video helps you, I hope that you will share it. So let's get started. Okay, modifier 26, probably one of my most frequently requested videos for modifiers to get a further explanation. So I hope that my explanation today will help you. I'm going to leave the link to the article that I am referencing in today's video. This was a very good article, and like I said, I'll leave the link down there. If you have any questions, look on that link. You can also look in Appendix A of your CPT Professional Edition AMA manual, okay? Let's start off with the definition of what is modifier 26. This is the professional component. Certain procedure are a combination of a physician or other qualified healthcare professional component and a technical component. Okay, when a physician or other qualified healthcare professional component is reported separately, the service may be identified by adding modifier 26 to the usual procedure number. So let's break down, what does this mean? Professional and technical component. Professional component is talking about the provider. What are they doing? Their report, their interpretation. That is what professional component means. Technical component is referring to the technical side, like a technician that is administering this test, okay? Now there's different rules, but that's just to sort of get your mind to kind of get what each one of them means. Now there are other modifiers that refer to this. I think the TC modifier is another one, but I have to do that on a separate video because I don't want to put too much information about so many different modifiers on one video. I want to kind of concentrate on one and move on from there. So this really good article from carecloud.com, excellent at explaining the details of when to use modifier 26 and when it is inappropriate to use modifier 26. So I'm going to read from there what they have. So modifier 26 can only be used on certain kinds of procedures, and certain kinds of procedures which include a professional component. Okay, now defining modifier 26, a combination of a professional component and a technical component. Most often you will see this among diagnostic testing procedures such as ultrasounds or CT scans. When the professional component is one such procedure is performed separately, the specific service performed by the physician may be identified by adding modifier 26. Okay, so professional component is outlined as a physician's service, which may include supervision, interpretation, or a written report, sort of like what I said along those lines earlier, without having performed the test. Let me read that part again. So professional component is outlined as a physician's service, which may include supervision, interpretation, or a written report without having performed the test. So the provider cannot have performed the test, okay? In short, modifier 26, in its correct use, reports that a physician's service was to interpret the results of a test when they didn't personally perform it. Wondering when this type of scenario would occur? These clinical scenarios, okay, I'm going to read them to you. These are excellent examples from this article. So a sleep center performs a polysomnography. I always flub up that word. You guys can see the article, okay? For a patient. A physician is not associated with the sleep center facility, interprets the findings of the test. This physician would append modifier 26 to 95811 to represent her interpretation of the polysomnography. If you don't know what 95811 is, it is polysomnography on a patient 6 years of age or older, sleep staging with 4 or more additional parameters of sleep with initiation of continuous positive airway pressure therapy or bilevel ventilation attended by a technologist. That's going to be your keyword right there for you to recognize. This procedure is done by a technologist. So the provider has to look at these results and give their own interpretation. So that is when you would be able to report 95811 with the 26 modifier, because this is going to signal that this provider did not physically do the test, but they're interpreting the results of this test. Okay? Because it was done by a technologist, and they're the ones that's looking at this whole thing, and they're giving their interpretation of it. Okay? So the next example is a pregnant patient presents to the ER with premature contractions. The ultrasound performed in the hospital detects abnormalities in the pregnancy. The patient is referred to a specialist for follow-up, and the hospital imaging report is sent with the patient for further review. The specialist reviews and interprets the ER ultrasound so that the specialist would be able to use modifier 26 on the ultrasound CPT to represent their interpretation only service of the report. Okay, so you see how that happened again? The specialist did not do the CT scan, but they did get the report, and they're able to do their own interpretation because they are a specialist. Okay, so that's another thing to consider. They did not perform it, but they have the imaging, and so they can do their own report. Okay. The next one is a treating physician orders a test from an outside laboratory for his patient. The lab's pathologist then provides their written report to the attending physician. In this case, the pathologist could bill the procedure 83020 with a modifier 26 representing their interpretation of the test. So the pathologist is a very important figure as well. So they have to be able to get paid for their interpretation. And in this case, it's saying that they are getting paid for their interpretation by stating that they're doing the professional side, okay? Obviously, the pathologist is not going to be the one that's spinning, right, the stuff. They're going to be interpreting what they see. So 83020 is a hemoglobin fractionation and quantination. I hope I said that right. Electrophoresis. That's what that procedure code is. So the treating physician orders a test from an outside laboratory for his patient. The lab's pathologist then provides their written interpretation to the attending physician. In this case, a pathologist could bill the procedure 83020 with the 26 modifier. So it is very delicate, but at least this way you guys can sort of understand how and why, all right? But the incorrect use of modifier 26, to illustrate the incorrect use, the treating physician in the above example could not bill 83020 with a 26 modifier themselves after they review the pathology report because the pathologist has already interpreted the test. The treating physician can include his or her own interpretation in their medical decision making, but they should not bill separately for it. So when it comes to evaluation and management levels, this is when all of this comes into play. This is saying that the pathologist has already done a report about what they see. The attending provider who sees this report can look at it. They can probably come to their own conclusion, right? But they can't bill for that 83020 with a 26 modifier. They can't do that because it's already been done by the pathologist. They can include their own interpretation of it in their medical decision making, right? That can be factored into their medical decision making, which can bump it up, okay? It'll bump up the level of risk. It'll bump up the level of complexity of the documentation that they had to review and things like that. So that is something you can keep in mind. When it's already interpreted, the provider cannot get it, okay? So it's a little weird, I know, but I'll keep going. So understanding, and it goes on to say, understanding the correct and appropriate use of modifier 26 will be key to filling out clean claims and avoiding denials for duplicate billing. Remember, the facility that performed the test must also file a claim for reimbursement of the technical component. This is why reporting modifier 26 on the same procedure code for the interpreting doctor will be critical in demonstrating your provider's specific role in the service performed. As such, reporting the modifier 26 correctly decreases your likelihood for incorrect payer denials and reduces in delayed payment, right? And it can be easy to become confused trying to keep the components of a procedure straight and remembering when modifier 26 should be applied.
Okay, so hopefully that gave you more information and it was clear. I really enjoy listening to her. I think she has a great real world spin on things. But I am now going to speak to you about being a cardiology coder. Did lots of EKGs, 93010. So my physicians would do these EKGs or have these EKGs done, and they would get the report and they would interpret that. So I always build a 93010 with a 26 modifier. Okay, I'm going to go one step further and say 78452 nuclear stress test. My doctors did not have the equipment in their offices to do the stress test, so they outsourced the equipment. So every time my doctors did a 78452, I would bill 78452 with a 26 modifier, because all that my doctors were doing was the actual interpretation. So I hope that that makes sense.
Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about
Let's see if we can. Sorry. I know, technical difficulties. Let's just scroll on through. Okay, so now we're going to talk about TC modifiers. She touched on it a little bit in her little spiel about her 26 modifier. So what is the TC modifier? The technical component describes the services of the technologist and the use of the equipment, film, and other supplies. Modifier TC is amended if only the technical portion is being coded. So this is for the use of the equipment, and it tells the third-party payer that, hey, Dr. So-and-so sent Mrs. Jones over to get a nuclear stress test because he doesn't have the equipment. I'm only doing the TC, the technical component. Then he takes that printout, sends it over to Dr. Cardiology. Dr. Cardiology only interprets the report that Miss Technology did, Miss Technical Component did. So 78452 TC, technical component, because he's using the equipment, film, the nuclear medicine. Dr. Cardiology gets the report, reads it, 78452, 26 modifier, because he interpreted what Miss Technical Component did. I hope that that made sense. If not, let me know and we'll go through that again. So global procedure. A global procedure includes both the professional and technical components of the service. No modifier is required. Dr. Hart owns his EKG machine. He owns all of his nuclear stress test equipment. He does everything right there in his office. So he does not need a modifier saying technical component or interpretation, professional component, because he owns everything. He's doing the technical and the professional. He gets all payments. Everything is due to him, which means they're not going to split it up. They're not going to pay the technical component for outside equipment, and they're not going to pay for interpretation for Dr. Cardiology. Dr. Hart gets paid all of it. Hopefully that makes sense. It does to me. I hope it does to you. I hope the light bulb just went bing. When only the professional component of the service is provided, the modifier 26 is placed after the CPT code. If a radiology clinic employs its own technologist and the radiologist, the global procedure can be reported. If a clinic performs only the technical part of the service and an independent radiologist provides the interpretation and report, the radiologist would report only the professional component of the service appending the modifier 26 to the code. Let's look at that. The clinic performs the technical part. Then they send the report to a radiologist, and the radiologist is going to interpret it. The radiologist gets the 26, the clinic gets the TC. I hope that makes sense. Attention! If only technical component was provided, you amend the modifier TC to the code. Modifier TC is a HCPCS modifier used with CPT and HCPCS codes. If both professional and technical components of radiology service is provided, you use no modifier. So if the clinic, the doctor is doing everything, they have the equipment and the supplies, and they're interpreting, then there's no modifier needed. So let's look at some examples. Professional component. 71048 with a 26 modifier is supervision and final report. Technical component. 71048 TC, technician supplies the equipment. 71048, no modifiers, means that both professional and technical component was given in one place. Let's talk about global procedure reimbursements. So third-party payers usually reimburse 40% professional component, 60% technical component, and 100% global, which that's just what we talked about. Okay, so here I go. I've broken my arm. I have to go have it x-rayed at X-Ray United. X-Ray United has the X-ray machine, the film, and all the equipment and supplies. They're going to send my X-ray of my arm over to Dr. Bone. Dr. Bone reads and interprets my report for my broken bone. X-Ray Ultra is going to get paid 60% for their technical component, which means their equipment. Dr. Bone only gets 40% because all he did was interpret the report. But if Dr. Bone owns the X-ray machine and the technician that goes along with that, and he pays that technician, and he owns the film, and then he takes it in the office and he interprets it, he gets all the money. Now we're going to talk about contrast material. Many radiology procedures require that contrast material be injected into the patient to make certain organs or vessels stand out clearly on the radiographic image. Codes in the radiology section describe only the radiology procedures, not the injections or placement of other material necessary to perform the procedure. I'm giving you a second to think about that. Codes are often divided according to whether contrast materials were used. You're going to see with or without contrast. The phrase with contrast means that contrast was administered intravascularly, intra-articularly, or interthoracically. Statement with contrast implies injection is built into the code. So let's look at what it is like to get a CT scan with contrast.
When you arrive for your CT scan with contrast, you will be greeted by a nurse. If your test involves an IV, the nurse will insert this before your test. Your CT scan is a way of taking many X-ray pictures of your body from different directions. A computer puts the pictures together to let the doctor see bones, blood vessels, and organs. Most patients do not need to remove any clothing for the scan. However, you may be asked to change into a gown or remove some clothing depending on the part of your body being scanned. Your CT scan will use a special dye called contrast. The contrast will move throughout your body in your blood. The contrast will allow doctors to see inside your body. You will take the contrast by drinking a liquid, or you will have the contrast inserted into your blood using an IV. After your IV is inserted, you will talk to the technologist about what will happen during your test. The technologist will answer any questions you have. The technologist will also ask you to take off things that might affect the image, like glasses, watches, and jewelry in the area that is being scanned. The technologist will ask you to lie down on a table for the scan. The table will move in and out of the scanner as it takes pictures. The scanner looks like a large donut. Unless your scan involved drinking contrast, the technologist will inject the dye using the IV line inserted by the nurse. The technologist will go into a different room to run the test. They will still be able to see and hear you using a microphone. You will be able to let the technologist know if you need anything or feel uncomfortable during the scan. A CT scan usually takes 15 to 20 minutes for each part of the body being scanned. It may take longer depending on the part of your body. You should ask the technologist how long your scan will take. At the end of your scan, the technologist will help you off the table. If you wore a gown, you can change into your clothes at this time. Remember to collect any items you may have removed during the test, like your glasses or jewelry. Be sure to ask any other questions you have about the test before leaving.
Okay, so that's our lecture on radiology. I hope that you guys enjoyed it. Like I said before, there's going to be lots and lots of parts to this. This is only part 2 of several parts. If you've looked at your textbook at all, which is going to be your homework for the Thanksgiving holidays, and I'm not supposed to do that. I'm supposed to keep these generic because I'm going to reuse them, but I can't help it. But you're going to be reading through the Thanksgiving holiday. You're going to have this chapter to read as your assignment. But as you're reading, you're going to see planes of body is a large section of your step-by-step manual. But don't worry, I didn't talk about it this time, but we are going to get to that. So you guys have a great afternoon. If you need anything, please let me know. Bye-bye.